All right, I'm going to try and explain some of these. It's kind of like pillar content. We're going back to the basics, but once you have a deep understanding, it'll make a lot more sense the significance of the thrombotic tissues. So let's start with this is skin here, and we'll have a blood vessel. Here's some red blood cells, platelets, leukocytes, all that stuff. We've got bacteria here. As the bacteria enters the bloodstream, or even in the area, it can release exotoxin, okay? What the exotoxin does is hacks the blood's coagulation cascade and create platelet leukocyte aggregates. So let's say these are all platelets. It'll start clumping together to the point that it blocks the vessel. Then when this happens, we have endothelial leakage. So let's say it causes this. Blood leaks, it goes into the skin, we've got blisters. So this is endothelial leakage because of platelet leukocyte aggregates causing tissue death. And then in here, the bacteria can start proliferating and create some upstream, downstream damage. And I gotta put some purple just to make it look like everything's all clotted off. And bacteria will use this environment to proliferate and start creating damage here. It'll create necrosis where it starts to look, this soft tissue and the anatomy starts to look mushy and difficult to tell. And then here, bacteria is winning. Here we can cause bacteremia in the bloodstream, and then up here we have horizontal spread to cause damage downstream. And as it travels further, it'll create more thrombose. So here's some thrombus. The whole blood vessel will become thrombotic. It'll look purple, bruised appearing. That's when you can actually see stuff, is when it starts being thrombotic. You could see it. You can't see the bacteria, but you could see its damage. And then lastly, once this all has happened for a sufficient amount of time, we start seeing gangrene. Gangrene is the latest visual finding of a necrotic type infection. So now let's take this into consideration of that toe example. Let's say this is a third toe. We have a bacteria. It enters, proliferates, starts creating platelet leukocytes aggregates everywhere, clots everything off. That allows the bacteria to proliferate. It'll spread down some more, create more thrombus. And then we start seeing gangrene. The gangrene is the late finding, necrosis is the medium finding kind of, and thrombosis is the early finding. So let's say we have the bacteria spread all the way to the metatarsophalangeal joint. Draw some thrombus here, and then since some time has passed, we got a little bit more gangrene to the tip. And of course, clinically, this is all gangrene. You might see a little bit of erythema all along here, right? Let's see some erythema. And let's say at this time we do the toe amputation. Here's a toe amputation. Now what you see here is a little bit of erythema and some thrombus, right? Here's some thrombus. But you can't see the bacteria. This is where we have to be critical about whether we decide to close or not. This is why when I see thrombus, the thrombotic material, I know that there's bacteria in there somewhere. It's got to be there. And this is a late finding. Now, if you don't see thrombus, it might be okay to close, but there also might be bacteria that has not created that thrombus yet. So that's why it's important in necrotic type infections to stage it, leave it open, and let the bacteria kind of declare itself. Because then when you come back, let's say this is at time of amputation, we leave it open. 3 days later, we see this. Just thrombus, no necrosis, no pus, no gangrene. But this thrombus is the early sign. Now you know that surgically, you got to remove a little bit more. You just debride all that, and then you should have your source control. Now you have an open wound that you can deal with, but at least it's clean. That's kind of how I think, and this is my framework for source control and why debriding thrombus is super important. Hope that helps.